Um, all right. Okay, so I'm just going to start slideshow. Right. Okay. So, hello everybody. Today I'm going to be talking about, how to become a clinical psychologist and to answer questions about, your curiosities about the career. I think most people that I was on an undergraduate degree with were interested in what it was all about, becoming a clinical psychologist. So I'm happy to talk to you today. So before I begin, I wanted to talk a little bit about myself, so that you have a little bit of context of who's talking to you, sort of thing. So I guess maybe I'll start from the bottom, actually. I did my BSc in psychology with clinical psychology at the University of Lincoln, and I graduated all the 12 years ago now, which seems like ages ago. And then I obtained my doctorate in clinical psychology at UCL, University College London, and graduated in 2017. So back up again, my past job since qualifying in 2017, I worked in a community learning disability team in Hackney, so all over London, brain injury rehab service in Wandsworth, and I worked there for 2 years. So I was in Hackney for a year, and then I worked in brain injury rehab for 2 years, and then I worked for 3 months as a sort of short-term locum psychologist in a child and adolescent mental health service in Richmond, and I currently work in Waterloo in staff support. So I work not with the patients in our hospital, but with our staff in supporting them with their sort of mental health and kind of thinking about team well-being as well in where I work. So I've done lots of different things, I guess, even previous to my kind of qualifying, but even now as I qualified, you can kind of see that I'm sort of a Amanda of all trades in a way. I'm 33. Yes, that's right. I had to kind of check that out with myself for a moment, and I identify as Black, African British. I describe myself to be a Christian. I was born in Zimbabwe. My pronouns are she, her. My interests are, as you can see on screen. I definitely love This Is Us on Prime. It's one of my favorite shows. So heartwarming. Such a way to kind of switch off from all the bad in the world. Yeah, so what is a clinical psychologist anyway? So I've got this screen up just to kind of represent that it's not one particular thing, because there can be some assumptions about who should be a clinical psychologist or who's likely to become a clinical psychologist, and actually these ideas are quite complex when we think about the proportions of people that do become successful at applying for clinical psychology training later down the line after your undergraduate degree. So I'll talk about this later when I'm thinking a bit more about kind of diversity in the profession. So this talk will cover what a clinical psychologist is, how we work, how you become it, diversity, barriers to accessing the career, and some quick advice and tips. And of course, Q&A, as Andreas talked about. And so these pictures I've got on screen represent some of the myths that are out there about what psychologists are, or therapists, or psychotherapists, or shrinks. That there's a kind of white male with glasses, very sort of wise and intellectual looking, who asks you to kind of lay on a couch and kind of tell all your sort of life history, childhood trauma, all those sorts of things on a couch until you get better. And then there's also ideas that, if you're mad or labeled as mentally ill, you are kind of put away in an institution in a straitjacket. So there are all these kinds of assumptions when we think about mental health, and thinking about the stigma as well of mental health and what people picture in their minds when they don't quite understand what the role of mental health professionals are, and actually how much the stigma and all of those negative messages have changed over the years. So what clinical psychologists actually do in terms of the 21st century practice. So they're in the past, there was kind of a role for the laying on the couch, for the kind of male analyzing the person. But actually now we have the sense that actually the person, especially the way that I work as well, the person that comes for help from a clinical psychologist is almost like, you know, someone who, they are the expert of their lives and you are the expert of psychology. So you're collaborating together to make to, I guess, support the person on the journey to their wellness, whatever that might look like. So what does clinical psychologists, what are we actually doing in sort of the 21st century? So in terms of assessment, so there's 4 core things. So thinking about assessments, formulation, therapy, or what we call intervention, and then evaluation. So all of these 4 things are really important considerations and parts of our training as psychologists. They're a core part of how we train. So the first part I'm going to talk about is assessment, which is where we gather information. So assessment is so important, and one of the first things you learn in lots of detail when you get your first jobs after your undergraduate degrees, or when you're a new trainee on the doctoral program. Assessment is your first the first step to understanding what's going on. And formulation is then where you try and make sense of that information gathered. And I guess formulation isn't just kind of you making guesses, but you're using psychological theory in order to make sense of the difficulties and the problems that are being presented to you, whether it be in a family, an individual with anxiety, or a team going through lots of conflict. We're thinking about formulation and using psychological theory to help us inform our understanding of what's happening. And then once we understand what's happening, we use evidence-based approaches. Approaches based on research that's already established and ways that work. And that's why some psychologists are called scientist practitioners, because you're using interventions that are based on your formulation. They're based on treatment approaches that are evidence-based, based on research. And then in order to kind of think to ourselves, does what we're doing actually work? Because not one size fits all. And that's very important to think about. So what we do in the last step is evaluation. So thinking about how we can gather information about, you know, does what we're doing actually, is it helping? And if it is helping, in what way do those things, what things have we been doing that actually help? So we, in my role, and the roles I've done in previously, we've gotten feedback from clients or other colleagues in order to get a sense of how people are experiencing the therapy interventions that they've received. And it's also important that psychologists develop reflection skills. So being able to kind of think about, you know, the work that you're doing in a sort of critical way. And when you're critical, you're not sort of saying, oh, you know, I'm a bad therapist, but you're kind of thinking, okay, you know, in what ways did, you know, did I kind of contribute to good outcomes or extra anxiety for this person? Or you're also thinking about, you know, how am I feeling about the work that's happening? You know, am I finding myself feeling distressed or upset or angry when I'm working with people? Because we also have emotions too. So it's very important that clinicians and clinical psychologists are able to reflect on how they are feeling and how they're responding to the work and how they can improve their work. Essentially, that's what evaluation is all about. And so reflective practice is something that's often talked about a lot when we're thinking about training psychologists to qualify. So I just have a little sort of task for you guys. I always do this every year just to kind of get you guys sort of doing a little bit of assessment, and maybe a bit of formulation. And so I'm going to ask you, I'm not going to put you in groups or anything just because of time, but just kind of thinking, imagine that you guys are a team of psychologists. So you as undergraduate students, and a GP, a general practitioner from a family doctor practice, writes to you and your clinic and says, dear doctors, so assuming that you're all doctoral trained psychologists, could you please meet with Mr. City, who came to me with stomach pains, fast heartbeat, breathlessness, and dizziness. All medical tests and scans show no physical causes. Mr. City is 25 years old and recently dropped out of his PhD program. He says he has a 2-year-old child that he has not seen since they were born. I'm not sure what to make of this. Please assess. Okay. So if you were a team of psychologists, what would you be interested in finding out more about, and why? And what's your initial impressions of this case, so to speak? So I will kind of, maybe ask a couple of people to give a few responses, and see what you guys make of this. So anyone want to comment, or and there's no right or wrong. There's lots of different ways of approaching this, so it's just kind of a nice way of Eleanor's got her hand up, I can see.
So I guess my guess would be that maybe I would like start to think along the lines of anxiety because of the physical ailments of like having a stomach pains and fast heartbeat, breathlessness, dizziness. And I'd want to probably investigate more about his relationship with his child, because obviously like the relationships we have with people are really important, and like parent child relationship is quite a big focal point of a lot of people's lives. So to hear that he's missing that, I'd wonder if that is causing him some distress, see how much like control he has over that.
Yeah, really, really great responses there. Yeah, thinking about, how is this kind of rupture in this relationship, or the change in this relationship had an impact, and also thinking about, are these signs of anxiety, these symptoms that are appearing. Any other thoughts? Anyone else have any other kind of ideas?
So Olga says in the chat that I think she's very interested in kind of understanding the experience he has while dropping out and not seeing his son. So what is like the subjective perspective I would kind of suggest? There's like, how does he see these events, right? How did he experience them? I think it's a very good point.
Yeah, absolutely. Yeah. So kind of getting his perspective. And it's so important as psychologists that we don't make those assumptions, and kind of try and explore what's your experience of that. Maybe what's the story behind the separation as well. Anyone else got any other thoughts?
We can also potentially ask if this is a frequently occurring symptoms in a specific situation, or is this more whether it's situation specific, or is it constant for him, so that he experiences one of all of these symptoms continuously, because that could give a potential indicator.
Yeah, absolutely. And I think one of the things that are really important as well is thinking about, exploring, the intensity of these symptoms, as you say, and when they show up, and also perhaps I would also be thinking, when did they begin as well? When did these problems start? And were there any events happening in his life that kind of may have triggered? And perhaps the child separation and the anxiety may have been kind of happening around the same time. And any final thoughts before we move on? Okay. All right, guys. Really good effort there at some assessment thinking. And so I guess in a situation like this, after we'd seen the person and done a full assessment, we'd be thinking, okay, perhaps it may be that they need some treatment for anxiety. Perhaps there might be something around sort of working with the family, perhaps. So psychologists can do family work if there is a kind of situation of kind of tension with the mother of the child, perhaps, or the extended family. So there's lots of different ways that we can kind of take this piece of work. Let's see. And also, I guess from this example as well, when I kind of go into the sort of neuropsychological work, another thing that psychologists can get involved in is sort of thinking, he dropped out of his PhD program and he's got lots of anxiety. We also, as psychologists, we also look at kind of cognitive assessments and things like that. So it may be that he has dyslexia or, difficulties in his learning that have also gotten in the way, which may have also impacted on this. And thinking about social skills, for instance, I'm kind of going all over the place now, but lots of different things could be going on. Perhaps there's he may have been on the spectrum and things got too overwhelming. All of those sorts of things can kind of be going on. So yeah, psychologists kind of think in so many different ways depending on what's presenting. So in terms of the diverse roles of a clinical psychologist, we do kind of neuropsychological work, which means assessment and treatment or rehabilitation in the context of brain injury. I've worked in neuro rehab before, and it's a combination of sort of therapy skills, but also being able to be very objective in kind of observing and measuring how someone's doing in terms of the link between their brain functioning and their behaviors in the everyday situations. And then psychologists work in teams a lot with other health and social care professionals, and also outside of healthcare as well. They can work in teams. Clinical research, you guys might already be very aware of this because you're going to be doing your dissertations and things, but psychologists are also very involved in developing new therapy approaches or refining the ones that exist already. And then leadership skills, which include supervising and teaching others. And then there's this idea of providing consultation to others, which is kind of a big part of my role at the moment. So I work in a hospital environment with largely non-psychologists, professionals. So what I'm doing in teams is bringing a psychological expertise or psychological experience and expert opinion in order to kind of support the team in sort of thinking about how they can make changes to the culture, to behaviors, to sort of procedures that have a positive impact on people's well-being. And I guess psychologists are influential on a wider scale. So, psychologists, colleagues of mine work in social policy and local communities with gangs, refugees, vulnerable young people and adolescents. I know people that are working in the media, providing mainstream psychological education, such as self-help books, and so on. So it looks more like this rather than what we'd seen before back here. So bear with me. Now this is kind of slowing down a bit. I think I'm speeding it up too much. Okay, bear with me, folks. There we are. Okay, I need to go back slowly. So I'm just trying to get back to, yeah, there we are. There. So it looks more like this. So we do research, write books, work with teams and collaborate in the community, assessments, therapy, all sorts. So it's a really diverse career with lots of different transferable skills. So how do you become a clinical psychologist in the UK? So this first page here, the very basics in terms of the boxes you need to tick. So before getting on to a place onto the 3-year doctorate, you need at least a 2-1 bachelor's degree in your in psychology, and And some doctoral courses look for a score of 65 or 67 or more. And this degree must give you a thing called the graduate basis for chartered membership. And most courses in the UK have this anyway. It's accredited by the British Psychological Society. And then further studies may be needed if someone gets a low 2-1 or 2-2, so that might be a master's, or some people go on to do a PhD. Or if someone's kind of done like a different degree, like say geography, they could do a conversion master's degree in psychology to kind of help them to meet that criteria in terms of education. And then you need relevant clinical experience. So anywhere where a clinical psychologist might work, or any population that a psychologist might work with, and you need kind of 1 to 2 years of postgraduate work experience. But in most cases, I think it's around sort of 2 or more years in my experience. And then examples of relevant experience include becoming an assistant psychologist, a research assistant, a psychological wellbeing practitioner, volunteering, or working as a nursing assistant in an environment like a mental health a service, like a secure hospital or an eating disorder service, whatever that may be, wherever a clinical psychologist might do some work with people. And then the doctorate. Once you get onto the doctorate program, congrats, it's hard work to get onto the program. And then once you're on it, there's more hard work. You attend teaching days and you complete assessed academic work. So you've got different placements across 3 years. Usually people do between sort of 4 to 6 placements. Some are a year long, some are 6 months long, but it's, you're doing your training in 3 years. This covers work with children, adults, older adults, people with neurological or learning disability, physical health difficulties, all sorts. But essentially there's a criteria of different things you must have in terms of the variety of experience you must have. And then you complete a thesis, which is your major research project. So think about your dissertation times 3 in terms of the word count. And then, so you work on this throughout your training, or, between sort of 2 to 3, well, around sort of 2 years, because in your first year, you're still kind of finding your feet, etc. And then I wanted to kind of talk about the stats a little bit for getting onto training. Because I think people want to kind of get an honest picture of what it's like. These graphs show 7 years worth of data that demonstrates the amount of people that applied and the percentage of people that got onto the course. So as you can see, over time, there've been and sort of an increase in the amounts of people that have applied over time. However, what we also know is that the places have also slightly increased in the last couple of years as well. So from sort of 2019 to 2021, places have increased, and I think they're going to continue to increase because of just the recognition by the government, by the NHS, that we need more mental health professionals, we need more clinical psychologists. As you can see, from 2015, it was around 16% of people that applied would be successful, and then now it's between sort of 18 to 22%. So in 2021, there was a higher rate of successful candidates in getting onto training. It still doesn't seem like a big number, and a lot of people think, oh my goodness, I'll never get on. That's like 1/5 of a chance. But actually, I think, or close to a quarter. But I think it's really important to remember that there's so many different factors that impact on who applies. So a lot of people, for instance, will apply when they're not quite ready for training. So people who don't have enough experience, or they haven't finished their degree, all sorts of things. So that adds to the numbers of people that apply. But essentially, when people are ready and they've got all the experience they need educationally, things are sound. In general, it doesn't take too long for people to get onto the course, but sometimes it takes, you know, a couple of applications for people to get on to training. And that's completely normal as well. So I now wanted to talk a little bit about, so there's currently no questions quite yet.
I think, I mean, there's one question that might be of interest that some people message me like privately. I think one question always is, can I collect basically work experience during my degree to then basically have the qualification? And I answered these people in the chat, no, you have to get work experience with your degree as a qualification to then get on the doctoral program. Is that correct?
So was it you need the degree and the experience?
So let's say I'm a psychology student. I do a one-year placement during my bachelor degree at the NHS, some kind of NHS trust. Then, but that doesn't count as work experience to get on the doctorate because it was during your degree, right? You need to have it after your degree. That's how I understand it.
Actually, that experience that you do as an undergrad, and the reason that those courses become popular is because that experience does count. But it only counts if depending on the quality of the experience as well. So if you do like work experience in sort of say a data collection agency, and you see a psychologist once a month, you know, I mean, I'm being very sort of facetious, but then that won't really count as relevant work experience, even though you kind of worked in the NHS and you were collecting some data. But if you are, say, because I knew some placement students who came to work in neuro rehab, and they actually contributed to running groups, and they sometimes contributed in meetings, and so depending on the quality of the experience, and sometimes you get lucky, sometimes you're not so lucky, that does count. But when you're an undergrad though, and you do that experience, you still need some more experience after your degree as well, but it does give you an advantage. You do it does. So
okay, so just to be clear, because I always say like, yes, get that experience to then be right away kind of competitive to get into a psychological well-being program or an assistant psychologist job or any kind of sought after. I think now they have, what is the other one, the that combines low and high intensity therapy. There's another program now where you can apply to, but I think you can't just say, oh, I did a placement, I don't need any work experience anymore, right?
Yeah, that's right. So you do need extra, but that does count. So I am currently rating some application forms for the 2022 intake, and so if I saw that on someone's application that they were an assistant psychologist whilst they were an undergrad, I would actually be rating that as experience alongside other bits of experience too. I wouldn't disregard it.
Okay, that's very good. Okay, that's great to know. Okay, thank you so much. Happy I asked that.
All right. Okay, should we move on, or do you have any other questions about that?
Then maybe just move on.
Okay, all right. Okay, so now I'm just going to talk about social inequalities, diversity, and clinical psychology. And before, I guess, with everyone's talking about ED&I left, right, and center, I imagine, for so many different reasons. For novel, I guess for what was the novelty, not novelty reasons, but sort of for kind of box ticking reasons, but also for kind of genuine wanting things to change reasons too. And I guess one thing that's really interesting as I'm sort of rating these application forms of the 2022 intake of trainees, one thing I'm observing is a lot of people are talking about, you know, working with multicultural cultural groups and understanding social inequalities and things like that. And they get a point from me because that's part of the criteria, actually. So this is really important, and it's being recognized by the courses as well, of being something that's really important. Andreas, I see your... Did you want to say something? Yeah.
I just want to kind of add, I don't know what's coming up, but I think we had a diversity event around BAME and clinical psychology last year. And I said, like, this is also a question that often comes up now in interviews for the doctoral program, where people are like, okay, like, have you thought about that? So it's like, even if you're like, oh, this doesn't really apply to me, I think you have to be kind of, reflected on it and what it means to bring, like the culture that the service user has and that you have, and like what that means and how it impacts the therapy and so forth, I think, or working with colleagues and so forth. So I think it's an important topic. I just want to kind of raise that. And it's not just, as you said, like, oh, just tick the box. Oh yeah, diversity.
Yeah, absolutely. And I think in the interviews we're going to be doing, I think we're going to be sort of asking people how they actually put those values into practice in their work. So I think you actually have to have, I guess, demonstrable experience where you actually take into account these issues of kind of inequalities and how you try and address those inequalities as well. Okay, so following on from that, I'm going to go to the next slide and talk to you a little bit about kind of what we see in terms of just in general in mental health. So more women than men report experiences of common mental health problems, and that includes kind of your full range: anxiety, depression, phobias, panic, and obsessional distress. So this kind of demonstrates that actually we're not capturing men as much, but we also know that men are at higher risk than women of suicide. So that's something that tells us about the inequalities inherent in mental health, that men don't feel able to, or a lot of men, I guess, culturally don't feel able to come forward and talk about their mental health difficulties and try and get to help. So it's easy, so it feels so overwhelming that actually people feel isolated and then end up and ending their lives as a result, rather than getting support. Also, unemployed individuals report higher rates of common mental health difficulties. People in Black and ethnic minority groups experience higher percentage of common mental health difficulties, and actually they're less likely to get appropriate support as well in services, public services. Even private services actually aren't really designed for people, I guess, more broadly, from sort of Black and ethnic minority groups. People living in deprived areas, people with disabilities, and those identifying as kind of non-heterosexual, again, are less likely on average to recover from their mental health difficulties after seeking therapy, which is really interesting about kind of who is the therapy for, and who is it designed for? What kind of person is it designed for? So diversity in clinical psychology trainees is really interesting to kind of look at as well, because these are professionals that I guess represent who does the helping as well, and they're the ones who determine what kind of what we're researching about, right? When we're doing our doctorates and things. So diversity, covers a broad range of categories. So that means different things. So I'm only highlighting a few things so that we can just pay attention to a few things together. So I don't have the 2021 data, but I had the 2020 data because it hasn't been published yet. But they usually follow kind of similar patterns year after year. So 83% report that they've got no disability. 3% don't actually want to say whether they have a disability or not, which tells us something about their concerns about discrimination. 82% identify as white, so these are people that were successful in getting onto trainings rather than people who applied. So 82% that identified as white were successful, even though 78%, which is lower, were actually in the total of applicants, of white applicants. So we can see a high proportion of white candidates being selected, even though they're not being represented proportionately in the total kind of applicants. 72% reported having no religion, and 6% stated they prefer not to say. So again, another question about whether people feel confident to be who they are in these sorts of professional spaces. And then 80% reported that they were heterosexual. So, and then in terms of socioeconomic group, I will look at on the next slide. So on quintile 1 represents people from the lowest socioeconomic groups. So these are the people that kind of were successful at getting onto training. And then quintile 5 is people from the highest socioeconomic group, and that's measured by people who lived in areas where there was higher uptake of higher education, so people going to university. So we can see that there's a much lower rate of people who are being successful who are from the lowest socioeconomic groups than the people that I guess have more privilege in many ways. And so diversity in clinical psychology, in future clinical psychologists. So I think for me, I'm very passionate about this because I think we need a more diverse workforce in order to serve the needs of all of the kind of all of the groups of people that are underrepresented or underserved by mental health services currently. Things are changing, but you know, it's taking some time. It's slow. So so we need more clinical psychologists that represent sort of minoritized groups. And so there's this increasing need, but what are the barriers, and how can barriers to pursuing the profession be overcome? And so there's lots of different things. So that can kind of be discouragement, the competition, the stress of being, you know, of applying for the course, the issue of degree classification. So some people, due to their, I guess, their personal circumstances, whether it's, you know, some people may come from backgrounds where they're the sole carer of very ill parents, for instance, or they've also got to work whilst they're doing their undergraduate degree. So they may not achieve to their full potential as a result, and I guess those kind of patterns might be seen more in minoritized groups. The issue with working for free, so some people will really struggle to do that. So volunteering to get relevant experience is absolutely okay for people that can afford it, but if you can't, that's a real struggle. And then the length of training and the education pathway. So some people want to earn you know, something that will help them to survive quite quickly, and sometimes it can take time to get onto training. The pay, it's not the pay before you get onto training is it's better than it used to be, I would say, if you were an assistant psychologist. But say you're a healthcare assistant, the pay is quite low. And then there's also lack of access to information about the career, although myself and my friend Steve tried to address that in the book we wrote together. But again, it's, you know, it's hard to find out this kind of information if you don't have a great sort of you know, lecturer like Andreas to kind of give you access to information and resources. And yeah, it's about who you know and where you are as well sometimes. And yeah, so lack of information, and then also the cost of paying for a master's, for instance, if you need to pay for a master's, is also a barrier. And so I guess I have some advice and tips for some of you before we kind of go into questions. So you know, asking yourself, you know, is clinical psychology a career that you value, you know, and why that might be the case, because that's a really important question to ask yourself. And I think even in some of the applications that are really strong that I'm seeing in terms of people that will be shortlisted for interviews, I'm seeing that people have a real passion or real connection with being in the career, whether it's because of their own personal experiences of mental health in their family or themselves, or just that being a very strong value to them. And so that's an important thing to kind of reflect on, I guess. And also at undergraduate level, you know, I definitely would say focus on getting the best degree grades that you can. Easier said than done, of course, but I think that's a really, really important thing to kind of consider as a way to sort of fast track your way onto training in a way. So adding psychologists or assistants or trainees on Instagram, LinkedIn, blogs to see what they're up to, what they share, that kind of gives you information about what's going on in psychology. Once you finish your degree, you can join the British Psychological Society as a graduate member. You might be able to join as a student too, actually. If you identify as a minority, by reason of your ethnicity or parenting responsibilities, your sexuality, health issues, disability, whatever it may be. There's a group called the Minorities in Clinical Psychology Facebook group. I haven't actually seen them in a while, but it's a really good sort of spaces to kind of find out about what's going on in clinical psychology for minorities in terms of events and things that can support you. Again, and this is for everybody, you know, once you finish your degree, you can create a group, or otherwise you can join the graduate psychologists or assistant psychologist groups. There's lots of communities where people get together and support each other. Look for courses or volunteer work. I know I just sort of said about volunteering not being kind of a space where you can earn money, but if you can, I would encourage it. Looking for work, and email psychologists who to see if they may have opportunities available or coming up. And you can present or publish your research if you can. This is your undergraduate research, which could help you in your application when you're applying for training as well. It's just kind of demonstrating your academic skills and abilities. And reading as much as you can around current issues as well in psychology. The Psychologist magazine is published by the British Psychological Society, and that's a really good resource. If you need to plan financially for a master's, do it early. And yeah, find a mentor or access a mentoring program. And I think many things are a Google away or a LinkedIn away maybe these days. And I'd encourage you guys also not to isolate yourself because of the competition. It's really good to kind of, yeah, as I've said, joining a community and learning together. And I think for me, when I got onto training, that's one of the biggest things I learned is, you know, getting support from colleagues and from people who are going through the same thing can help you go a long way. I think there were 10 assistant psychologists where I worked. And 8 of us got onto training the same year because we just got together and supported each other, and you know, and that was really useful. And so if you want to know more, Stephen lives in lovely sunny Australia now, but we published this book together, and we actually met when we were assistant psychologists before we got into training, when we got this idea, why don't we write a book about this? Because it was so hard to get, you know, the information that was helpful and needed. People should be able to access this easily. And I said to him, yeah, why don't we write a book about it, you know? And here we are. So that's what we wrote about. So information about how to become a psychologist, and you can access this book on Amazon or Waterstones or Routledge, wherever. And then I also have I've written an introductory sort of I wouldn't say it's not an article really, but it's an introduction to resources that the British Psychological Society keeps for people who want to become psychologists, applied psychologists. So whether it's clinical, occupational, counselling, and so I'd encourage you to visit this page, which is on screen. I'll share the slides with Andreas as well, and so they've got like heaps of information about sort of what what might be helpful for you guys to learn about if you're interested in pursuing careers in applied psychology. So I think we're in good time. Any questions? I think we've got time for quite a few. So
could I ask, start with the first question, and then we see. I think one question I often, when I talk to my students, I think maybe do you want to stop sharing your screen and then we can
yeah,
see?
of course, yeah.
I think
Yeah.
and I can just pop myself in there. Okay, whatever. Masters. It's like if students come to me and it's like, oh, I want to become a clinical psychologist, I'm looking for masters. Like, why do you want to do a master's, right? And so I say, you don't need to do a master's. It's not part of the criteria to apply. It might just kind of like get work experience, try to become an assistant psychologist, a psychological well-being practitioner, support worker. Even if you're just a support worker, this will be much more valuable than doing a master's. And so I just want to double check because I think like it's easier to do a master's, which is like, oh, I don't know what I should do, so I do a master's. It's like, oh, you don't want to waste all that money. And if you become a clinical psychologist, you have to pay it back because you will earn enough money to. So is that good advice?
I think it depends. So I think for people who, for instance, have a high scoring degree, if you have a high 2-1 or you've got a first class degree, I wouldn't, advise someone to pay for a master's unless it's something you're really interested in kind of looking into. And of course, but if you're just getting a master's because you kind of just want to, add something to the CV to get onto training, then I would say there's other ways you can do that. So you can become a research assistant, for instance, if you want to work in that sort of academic environment. So becoming a research assistant in a clinical setting. So thinking about, if you're doing research with people who've been diagnosed with psychosis or anxiety or whatever it may be. But I would say if you got a low 2-1 or 2-2, then I would be considering a master's because the process is very competitive. And so one of the things that they do is they separate the scoring into 3 parts. So there's the academic, there's the clinical, and then there's your references, and they all have equal weighting. So if your academic demonstrates that actually you have all these great things clinically and your experience is lovely, but your degree is lower, that will disadvantage you against someone who may have got a higher degree, like a first class degree, for instance, who has maybe slightly not that great experience, but they score highly on their, on their references and etc. So that can put people at a disadvantage. So you just want to give yourself a good enough advantage so you're on par with someone who got a high degree, so that you're kind of scoring the same as them. Because at the end of the day, when it comes to selection, it's also about kind of how you score.
So that's interesting. Could I just follow up that? Because I often think, so one question I kind of always have, like, if a student graduates with a 2-2, what do I tell them, right? And I think like I heard a little bit like conflicting information about, can you make up with a good master's for maybe like a 2-2 in your bachelor? And do you suggest you can? Is that correct? You can like, oh, now I have a 2-1 in a master's.
Yeah.
I don't know.
So I guess if you got your 2-1 or 2-2 perhaps, and you got a master's, that might help you to kind of make up for the not getting a first or the high 2-1. And I say this with a bit of a caveat, and I say you know, when you're doing your application, rather than just saying, oh, well, I did the master's in the end, I was partying too much on my undergrad, so I did the master's sort of thing. They also want you to demonstrate your reasons why that score wasn't high in the first place. So I see a lot of people who get a 2-1 say things like, you know, I had extenuating circumstances, something happened in my family, etc., which kind of led me to kind of this position. And that's always very encouraged if you feel like actually the grade I got in the initial undergrad wasn't as high as I wanted it to be. So I would say, yeah, in those situations, a master's might be necessary, but it also helps to kind of indicate in your application why that was the case.
Okay, great.
Yeah.
And could you, oh, here's like, okay, so yes, there's a question, I think Emily says, like, basically, can you replace work experience with a master's? And you can't. Like, these are two different buckets.
Yeah,
I think,
absolutely.
so one of the things, like Amanda just said, right, it's like you have the 3 buckets and you have to fill them all, right? And I think this is like why I often say to my students, you have a 2-1, just that's enough, you know, or you have a first, like, let's fill the experience bucket, and you have to fill that bucket even if you have a master, right? So you still have to do that.
Yeah.
So, okay. The doctorate is a good question. The doctorate is paid. I think maybe you can tell us a little bit about the doctorate. I think you apply, you do a 3 years doctorate, which is, could you just tell us a little bit about the ratio between research work and kind of clinical work? That would be, or like, I think I suspect there's some teaching. So you're like a student, you do research, but you're also immediately like a clinician in some ways, right? You're joining, like, and you rotate around, right? That would be great.
Yeah. So I guess all 3, so the research, the teaching, and the clinical. So how your week looks when you're a first and second year trainee, for instance, is you have 3 days on placement, so working in the NHS, and then 2 days where you're in teaching. Apart from your first 2 weeks when you're a first year, you're in teaching for the first month, I think. And then after that, it's 3 days placement and then 2 days academic. But in your third year, you might do sort of, you spend more time doing research than the teaching, I think, as well. And that's for kind of obvious reasons. You kind of, you know, need to sort of tie things over and things like that. So, but you're paid as an NHS employee when you join training. So you have a salary, and it's quite a good salary for a doctorate, actually. I mean, it's way more than you get on a PhD, I have to say. I mean,
double.
You could live a normal life on that money, get married, and, you know, support a family on the money that you earn. So you earn at a pay band called band 6. I don't know exactly how much that is right now, but
it's in the mid 30,000s, I think.
Yeah, and that's
like, or low, like 32, 33. Yeah. You earn more than the average person in the UK with that.
Yeah, absolutely. So when you're a band 6 trainee psychologist, you're earning you're not bad. It's not bad, you know. Yeah.
Okay, so there's one really good question about what do you think if you apply, what makes somebody it gives you the extra little something to stand out. I think that's a really good question. Now that we know that you're rating these, we want to get the inside scoop.
Yeah.
Okay, and then I think a very different but really good question. Maybe you start with that, just like, okay, what does it mean to be like being Black in a, I think, I don't know if it's like clinical NHS overall is very diverse, extremely, I don't know, like 40% of doctors are BAME. So that's pretty, I don't know, it's not a normal organization in that sense. I think it's pretty high. Maybe clinical psychology is different.
Yeah.
It seems like, maybe you can pick it up from there and then come back and what makes you stand out.
Okay, sure. So I'll talk about the experience of,
Yes.
I saw the question pop up. So I guess in terms of diversity in the profession, so I saw, how do you think being a Black woman impacted your overall journey? I guess in the profession is still very predominantly white, as you saw the numbers earlier. You know, most people who get onto training and are successful on training are from a white background. So I guess I was aware of this when I was applying, and it's disproportionate to kind of the overall NHS numbers. So if you compare nursing and even doctoring, like medical doctors, to clinical psychology, there is that disparity. And so clinical psychology does have some problems, actually, and I will admit that, in terms of equality and diversity. And that's something that the doctoral courses are trying to address even now, because I think there's an increasing recognition that perhaps Black students, Black psychologists are having a perhaps they may be having facing more challenges than the average challenges that you may face as a trainee anyway. So kind of just the pressures and, you know, feeling like, you know, you're a bit of an imposter and anxious and all those sorts of things. But I guess the system sort of might treat you as, well, I guess in my experience, and I guess the experience of others, the system might treat you as someone who's got to sort of almost prove yourself and work harder in a way, to demonstrate that you're good enough to be onto the course. And so I guess there are trying to address that and trying to kind of do more kind of mentoring support for Black and ethnic minority or minoritized groups of people who are joining the courses. So trying to encourage more spaces where people are voicing their concerns around the lack of diversity or racial microaggressions in the placements, for instance, because those things are still happening. They happen in all sorts of workplaces, including on training as well. So those are the things that kind of the courses are trying to work on. And I guess in terms of my position as now a qualified psychologist, I'm a little bit like hotcakes in terms of recruitment on these courses, you know, and people asking me to teach and facilitate things, because they demonstrate that actually they need people from diverse backgrounds in order to, I guess, level the playing field a bit more and provide equity, and not so much equality, because that's how I guess I was being treated before when I started my training, and maybe people before that, this idea that we're treating you all the same, but actually that's not recognizing the disadvantages that some people from minoritized backgrounds also face.
Okay, that's great. This was a like a wonderful answer. I think that's it's good to know, and I think we have the highest diversity in psychology in our program in the UK. So for us, that's always like, okay, what about diversity? That's on the top of our minds. So what if I apply? How do I stand out?
How do you stand out?
Yes.
I guess if you apply, how do you stand out? I guess get good quality experience, and if you, because I guess what I'm looking for and what a lot of people are looking for is with the experiences that you've had. And when I say good quality, it's like, oh, you know, it's not about working at the best hospital or having the best job title, but it's about what is it that you're gaining from the work, and what is it that you're saying you've learned from it. So what can you reflect about your learning, the experiences you had that's taught you, that's made you grow in certain ways, that's made you kind of change your perspective on things, challenged you. All of those things are really important. So it's not just, oh, I worked at Great Ormond Street as an assistant psychologist and it was lovely, but it's like, actually, one of the things that I learned about working with very sick children is this. One of the things I learned from working with the really desperate and scared families was that. One of the things that I learned about myself was that, you know, caring for a parent whilst doing this work is really challenging, and it's really taught me how to do X, Y, and Z, prioritize, multitask, you know, all sorts of things, or relate to my patients better. all of those sorts of things. What have you learned about, ED&I as well, all of those sorts of things, which gets you a point, by the way. I'll just put that in.
Yes, I think that's great, because I totally agree. There's it's somewhat true for all job applications, and in clinical psychology, I would suspect, especially a reflection. I think if people, not just the experience, but reflect on the experience, and you read the applications, like, oh, there's somebody who really gets it somehow. They did it and they experience it and they can write about it and they thought about it. So yes, I think that's like a really, really important point in any area of life, but especially probably in clinical psychology, where you have to be a little bit more self-aware, a little bit more. I think the other thing, I don't know, it's like I often recommend to my students to say, let your friends tell you how awesome you are, because I think in some ways people often they don't want to self-promote. They feel like, I don't know, I did this, I did that. And I said, look, you did so many things, so many amazing things. Why are you not talking about this? Why are you not talking about that? Why you can do this? So I think often asking friends to do the promotion for you as one part of the draft might really help you to see you in a more objective way, in a less critical way. I think there's some students we have often trouble seeing how awesome we are, because we're more in a self-critical mode. It's like, oh, I could do better here, I could do better there. So I think that's sometimes just like, oh man, just maybe this is my American influencer. It's like, promote yourself a little bit better. But I often feel that students are too humble about their achievements. Okay, I think I'm not sure, okay, what would you need to apply to become a system psychologist? Okay. I think theoretically, you only need a bachelor in psychology. I often say, basically, you do a placement during your bachelor, so you're competitive to get a system psychology job. I don't know any of my students who got it basically after graduating. I think the earliest is half a year later. I don't know and I think, yes. So that's my experience. Amanda, what do you think about assistant?
Yeah, I think assistant psychologist jobs are so competitive that I think it's rare to get them straight out of getting out of uni, but there are other jobs that you can do, sort of if you're a healthcare assistant or a support worker, which kind of gives you a stepping stone into becoming an assistant psychologist in in a service. So I think it can take a little bit of time to become an assistant psychologist, but that's not the only experience that's valued as well.
Yeah. So I think if you graduate, I always with my 2 days average, say go for a system psychologist, go for a well-being practitioner, go for support work, and go for volunteering. And maybe you need to struggle along for half a year, but one thing will click, right? Don't just say, oh, I'm putting all my eggs in that basket. I think I'm not quite sure if I understand the question about the placement year. You can't, I think, if you have a placement year, let's say you apply for a system psychologist, right? And you already did a similar role during your placement year at, for instance, Great Ormond Street. That gives you a clear advantage of getting the system psychologist job or getting onto the psychological well-being practitioner or the support worker. But it doesn't, you still have to get work experience after your bachelor. You can't just fill that bucket. Experiences, you need to pile on a little bit more, right?
Yeah, I agree. Yeah, that's right. Yeah.
So I strongly encourage it. I think we have in 2 weeks a placement event. If you want to know students who are on placement, we'll talk about their experience. I strongly encourage that, to be competitive when you leave university, to shorten the time. But you still have to do things. And if you're a system psychologist or a well-being practitioner, these are good jobs. It's not that you're wasting your years on something. And if you want to help people, then you're helping people, and it's something. Okay. How many weeks of experience is preferred? Does it not matter? Okay. So this is a tricky question, I think, Amanda. It's basically, I heard different things about this, but it would be good. So let's say I finished my bachelor degrees, and then I work for the Samaritans for a year, once a week. right? So have a year-long experience. How do you factor that in? How many weeks? How many actual hours is there?
So it's really interesting because when you're applying for the course, it does the calculation for how many full-time equivalent months that comes up to. So if you did Samaritans for an hour once a week, that would calculate as, I don't know, 2 weeks of experience or something, or whatever it might be.
Not quite, yeah.
Yeah, exactly, something.
Yeah.
You know, my math is terrible. This is why I didn't become a statistician. But yeah, so essentially, you have to have a substantial amount of experience, and I think this is a full-time equivalent of at least, and this is if you're very fortunate, 1 year post-grad or more than that.
Yeah.
Yeah.
I mean, like, I think we often talk about experience in a very technical term. I needed to get in. I think if you're considering this, if you're listening to this, you should also try and see if it's actually something for you. A lot of people experience this and don't like it. They don't like being part of the NHS. I don't know, you know, you might go in there and it's like, it's not really my thing. I think it's good to experience that as early as you can before you're stuck in a career that you don't really want to do. So I think there's another point to experience. It's not just, you know, not just ticking a box, but also like, is it actually something for me? Okay. I think if that's if there are not any more questions, I think I would draw it to a close. Sneakily, I Googled "This Is Us." It looks good while you were talking. Okay, I've not heard of it. I put it on the what to watch list. That sounds very good. Thank you so much. That's another great recommendation. It's always a little bit anticlimactic at the end of a Zoom event because nobody claps. We can only say thank you in the chat, but it's very, very much appreciated for those students who have been here. It was great. And those who will watch it as a recording in the future. So thank you so much, Amanda. That was great.
You're very welcome.
I don't know, like we might have one more event and then somebody else steals you and I'm not needed anymore to organize these events. But yeah, thank you so much. And hope to talk and see you soon.
Yeah, see you soon. Take care, everybody.